Welcome to the first week of CTN Cross-Sectional Anatomy Introductory course. In this video, I'll go through the syllabus and what to expect in the upcoming weeks. So let's start at the very top. We'll go through the syllabus. And some important bits. Some bits are going to be the same for all your courses. All right, so the important bits are the parts that I want you to pay special attention to is the time of this class. It's Thursdays 5:30 p.m. to 8 p.m. Every other week you're gonna have a video recording and probably an ED puzzle assignment. I'll talk more about that in a second. So it's on the class outline here. So on September 5th there is a video recording, and then the next week we'll have synchronous class, meaning we'll all be here together at 5:30, and it lets you know ahead of time. You can just see the whole schedule here. There are a couple weeks that are a little different. That's because of Thanksgiving week. So Thanksgiving week would be a video recording, but there's no class that week. There's still assignments which will be open the weeks before, but there is no video recording. All right. Next bits that you should pay attention to would be the grade summaries. You'll see that there are 4 quizzes, 3 home assignments, 4 discussion entries, and 2 class assignments. And they're all labeled here. You can see which week they're due. The next thing you should pay attention to is the due dates for each of these. Now it's gonna be on Blackboard. However, pay attention here. It's pretty straightforward. Each assignment is due, unless otherwise explicitly said by me, it's due the following Tuesday after the date first available. So this discussion entry, for example, which will be open as of 9/5 or the 5th of September, will be due the 10th. And so on and so forth. So something that's open on the 12th is now due on the 17th, and so on and so forth, right? Unless otherwise stated. And the quizzes are going to be due that day, right? The other thing that's important is there will be a 5% deduction on each late day for the assignment submission, and a 0 after 3 days. Very, very important. All right. And office hours, this is where you can log on to Zoom, and if you want you can ask me questions, that kind of stuff. If you have questions, you can just let me know ahead of time. Email me a couple of days before. I have some questions about last week's topic or whatever it is, and we can talk for an hour every Friday at 6 to 7. So if nobody emails me, I'll assume nobody wants to talk, but if you do, just let me know and I'll log on. This is going to be straightforward, same for all your courses. All right, the last thing I want to show you on the syllabus, you'll notice that there are a couple customary items that are missing, namely midterms and final. For those of you who prefer finals, feel free to email me and I'll be happy to create an extensive 100-question cumulative final for you. However, I have been authorized to construct this course devoid of finals and midterms. There are other ways that you can be evaluated, such as these. All right, so that's the syllabus. And so remember I said every other week we'll have a video recording, and the next week we'll have synchronous class. Well, you can see it. Week 1, video recording and the ED puzzle. The next week also has the date there. Synchronous class. A synchronous class meaning we'll be here together at 5:30. That continues down all the way to the last week, which you have a quiz. When you click each one, you can see what's being done, right? And here are your academic resources. All right, so when you see an ED puzzle assignment, before you can even get that started, you'll need to create or type your name in and join the open class on ED puzzle. Just in case there are some of you who are not familiar with this, you would click that link. I have to use a different browser because I'm logged in on Chrome, and please type your full name in here to join the open class. So we'll just say test student, join open class. And on September 5th, these two videos will open. They're pretty straightforward. How it works is you watch the video, answer the questions, move on. If you get it right or get it not, you can do it as many times as you need to, but watch the video, answer the questions, and the videos are pretty short. The 2 videos for this particular week's assignment. All right. Do not hit leave open class. I'm just doing it because I don't need to be on here. But once you've typed your name in and joined the class, do not hit this. All right, and then the Zoom link is going to be here to join the classes. Once you click that, it should take you straight to the Zoom page, and it's also there for, it's also labeled by date. But if you notice that the numbers are the same for all the synchronous classes, and the numbers are also the same for all the office hour classes. So if you click this one for this date, it will be the same. Regardless, feel free to go through and click on the right date. All right, so that's the syllabus, that's Edpuzzle. And once you're in Edpuzzle, if you see Edpuzzle as an assignment here, you just log into your Edpuzzle or click the link again, and you will see the assignment that's available for that day. All right, okay. This will be the outline for, so for example, week 1. So if you look at the syllabus again, you will see, if you look at the syllabus again, you will see, let me make it larger. Discussion entry 1, right? So that will be here, discussion entry 1. For this particular assignment, you just click it, you'll see choose one topic and write a minimum of 1 paragraph or 150 words on any one of these topics. Feel free to respond to your classmates' comments, but you don't have to. It's not a requirement for you to receive your full grade, and these discussion entries are graded. So again, you just need to do your part and you can respond to others. So just be sure to click through each of these, and I will go through the PowerPoint in this video. The next recording I'll do will not have this rambling that I'm doing right now, because you will already have the introduction. I'll get straight to the PowerPoint. So I'm going to do a recording of this PowerPoint, just discussing some things. I'll upload that as a YouTube link and I'll post it right here for you to watch as your class content. All right, so you should know this at a minimum. And as in, you should know this after watching the videos. It'd be nice if you know this prior to coming in, but at a minimum, you should know that. And then you'll have the PowerPoint and you'll have the YouTube link. All right, let's get straight into this week's short discussion. So all the PowerPoints I have on here will be about maybe at most just a few slides, something like this, maybe 15 or so slides at a maximum. All right, so this whole course is about CT and cross-sectional anatomy. However, I do think it's important to see how CT compares to other imaging modalities, and we'll talk about some terms that you will hear or you have heard so far in class and in hospitals and in your own life and so on. But it's important for you to learn the lingo, learn the vernacular. When we say imaging modality, when we say diagnosis, what are we talking about? All that's important, right? So we're going to go to an overview of related terminology and imaging modality. We'll start here on slide 2. So the first thing we'll talk about is, what's a disease? We all know, we've heard this term before, about disease and the different types of diseases. But how would you define a disease? Well, in short, and you can write this down, this is my suggestion to you. A disease is anything that impairs normal function. Anything that impairs normal function or an abnormal condition. This could be an infection, it could be a genetic disorder, lifestyle factors can impact this, that kind of stuff. But the simplest definition for a disease is anything that impairs normal function. I will be looking at different types of diseases on CAT scans in the coming weeks, and the intent is not for you to be on par with the knowledge level of a radiologist, but at a minimum you should be able to identify what's abnormal, just like you do in X-ray, right? So you're not going to be a computerized tomography technologist at the end of this. But if you walk into a CAT scan room and you see some images, or you get a CAT scan of yourself, you should be able to identify some basic things. And some of this basic thing that you should understand would be what's the disease process, what's abnormal about it. The next term that you should be able to identify would be what's diagnosis. Well, the diagnosis is the identification of a disease or condition. What's wrong? So you've heard this term before. The doctor would say, we got to diagnose this condition. So the patient arrives with an ailment or presents with an ailment, and the doctor says, we got to find a diagnosis. And once they arrive at a diagnosis or identify the disease condition, we then say, what's a prognosis? Well, the prognosis refers to the expected outcome, what's likely to happen, right? So that could be impacted by a bunch of things: how soon we catch the disease, how soon we start treating it, the severity of the disease, what type of disease, which organs are impacted, the type of treatment, that kind of stuff, right? And that will impact the likely outcome or the prognosis. The next term is etiology. Etiology is the origin of the disease, a study of the causes and origins or the reasons behind the condition. What causes it? This is not the same thing as the risk factor, right? But we'll talk about that in the course at some point. But etiology, strictly speaking, is the origin of the condition, right? So, for example, we would say that the etiology of brain hemorrhage could be hypertension, right? So the patient's blood pressure got too high and a blood vessel ruptured. We would say that the etiology of punctured lung, which causes a pneumothorax, would be a fractured rib from trauma, that kind of stuff, right? These are two basic examples. So the patient presents with some problems, and the doctor will start to ask questions, or the triage person will start to ask questions. So what's going on with you? And the patient will list a bunch of stuff. So let's say, for example, I present with nausea, vomiting, and temperature. I'm febrile or high temperature, and my skin is red. There's a bunch of things that are lumped into that description. And those collectively can be termed sign or symptom. Sign or symptom. A sign is any observable or objective thing that you can notice about a condition, right? So the important thing is a sign is objective, meaning everybody who looks at a sign will see the same thing. What are we talking about? Let's say the patient has a bump on their forehead. Well, that's a sign because everybody can see that, right? It's something that's objective. No matter who looks at it, they're going to see there's a bump on that forehead. Let's say the patient has a broken collarbone. That's also a sign because it's objective, meaning no matter who looks at it, they're going to see that there's a discontinuity of the bone and the bone is fractured. A symptom, on the other hand, is subjective. So, for example, the triage person might ask, well, what's your pain level between 1 and 10? Some people might say, well, my pain level right now is a 3. For others, their pain level might be a 10. That's subjective. There's no way really to measure that, at least in the clinical setting that we use day to day, right? So signs are objective, symptoms are subjective, meaning there's no clear way to see that or to observe that the same way by everybody. All right, so that's a distinction between sign and symptom. The last thing on the slide is inflammation. And an inflammation is a normal body process that helps the body repair damaged tissue. Right? It's a biological response to infection or injury. We've heard this term before, and the suffix that means inflammation is itis. So you've heard this before, colitis or appendicitis, that kind of stuff. We can see all that on CT easy, real easy. Whenever you see itis, I'm pretty sure you noticed by now, it means something is inflamed. It's a normal body response, normal biological response to injury or infection. All right, so just to review, what's a disease? Ask yourself these questions, make sure you write them down. It's any impairment of normal function. Diagnosis, well, what's the disease? We're identifying a disease. What's a prognosis? Well, the likely outcome. What's the etiology? Well, that's the origin of the disease. What's a sign or symptom? Well, the symptom is subjective, meaning it's different for everybody. The sign is objective. It's going to be the same observable thing no matter who's looking at it. So we can measure a sign is another way to say it, right? So we can measure a sign. You can measure a fever. You can get a thermometer and measure this patient is indeed febrile because their temperature is above the normal body temperature, 105 or 120, which will be serious, by the way. Inflammation, the suffix that means inflammation is itis. All right, so review questions. So you should try to write these down on your own time. However, we'll go through them slowly. So what do you understand about the term imaging modality? So far you've encountered X-ray in great detail. You've heard about the others at a minimum, ultrasound, MRI, nuclear medicine, that kind of stuff. Well, imaging modalities are a bunch of tools that we use to diagnose conditions. And these are the examples I just mentioned a few seconds ago, right? Some of those will be ultrasound, X-ray, MRI, nuclear medicine, fluoroscopy, and for this course, CT. CT just means computerized tomography. Computerized tomography. That's the description of that is going to be in the video, so you got to make sure you watch those videos on the ED puzzle. Now, how are these different and similar? We'll talk about in a second, but you start thinking about these things as in which one's radioactive, which one's not radioactive, which one's quicker, which one is more likely to impact patients who are claustrophobic, right? Start thinking about these kinds of things. Even though we're focusing on CT, we're going to try to separate this from the other imaging modalities. As a reminder, like I just said, make sure you write this down. An imaging modality refers to a technique used to visualize the body for diagnostic purposes. So it's a bunch of tools, a group of tools that we use to diagnose a patient. All right, and do you have a preference? If usually when I have this class in person, this is when we go around and ask people, do you have a preference and why? So some people would say they prefer ultrasound because there's no radiation, or some people say they prefer X-ray because it's quick. Some people would say they prefer MRI because of the detail. And some might have some traumatic experience with some of these, and they will forever be afraid of the needle for the CAT scan, so they don't want to have a CAT scan, that kind of stuff, or they're claustrophobic, so they don't want to do an MRI. So we might have different preferences. I actually do not have a preference. The one I like the least will be the MRI because I am a little bit claustrophobic, but if I have to do it, I will. All right, let's move on to slide 4. We'll talk about X-ray briefly. It's the most common. So a great majority of people who pass through a healthcare facility will have some type of X-ray. And even if you're not suspected to have a disease condition, you probably still have a chest X-ray at some point for a medical or some kind of workup. You're going to join a new job, or you're going to go overseas to certain places. Coming from certain countries, you got to have a chest X-ray. Doesn't mean something's wrong with you. It's just one of the things that we can do because it's relatively low radiation and it's quick. You can be in and out in maybe a couple of minutes, right? Doesn't require an appointment. You just go in, and if you're not pregnant, we can get it done. Even if you are pregnant, we try to do it still if it's necessary, right? Because it's so low amount of radiation. It uses ionizing radiation. Some of you should remember this. So ionizing radiation, that's a type of radiation that has the energy strong enough to knock off electrons or to create ions in your body, right? So in essence, it is kind of damaging your cells, but it uses ionizing radiation. All that means is it has the power to create ions. So as a reminder, we put up an image here. As a reminder, an atom has a nucleus and orbiting electrons. And if you have the same amount of protons and electrons, it's neutral. And if it loses an electron or gains an electron, it now becomes an ion. A cation will be a positive ion, and an anion will be a negative atom, right? So that's what's happening. So it can either it knock off an electron and create an ion. That's what's happening when we say ionizing radiation. Okay. Typically provides a two-dimensional image. Now, in years past, we would have early forms of tomography. Early forms of tomography. Let me put up an image here. Let me see if I could find this image. But it wasn't very clear, right? And it's called X-ray tomography. It's a huge contraption that's a little scary for patients, and the thing would move back and forth over the patient. And we would do it for procedures like IVP, intravenous pyelograms, right? And I'll show you what that looks like right here. So it's kind of like this, right? So the tube, it would just create layers of images, but it wasn't very detailed because typically X-ray creates two-dimensional images. So we just get length and width. So no idea of depth. So the images are all overlapping and it's hard to get depth information. So this is why X-rays are not the preferred imaging modality if we need more than two-dimensional information. It's performed in a controlled environment. What does that mean? Well, it's radiation. It's radiation. So we need to make sure that we're keeping the staff safe, and we're keeping the public safe and the patient safe. So we gotta have primary barriers, secondary barriers. I'm pretty sure maybe you've learned about it so far. That just means we gotta have enough shielding to make sure the radiation is not impacting, it's only impacting those who need to be irradiated, and you're protecting yourself also. The technologist is not required to interpret the images. All right, I put an asterisk here because you still have to know what it is that you're looking at. But that doesn't mean you have to diagnose the image. So for example, if you're doing an X-ray for, fractured, let me see, so for fractured bone, you should at the minimum know, did I get all of the fracture? Where is this fracture? Did I get the right body part? That kind of stuff. This is an exaggerated example, right? But let's look at, say, a pneumothorax. And you should be able to, at a minimum, identify what is wrong, right? So that's the thing with X-ray. You're not required to diagnose, but you should at least know what you're looking at a minimum, the most basic things. The next modality, next part of this we'll talk about is, we'll stick with X-rays, but we'll talk about some limitations. So we already said that we don't get depth information with X-ray, right? We just get two-dimensional images in general, right? Two-dimensional images in general. Do you recall whether X-rays are radioactive? This is very important for you to know at this stage. I'm sure you know this. It's not. Ionizing radiation is not radioactive. When we say radioactive, it just means that there's a spontaneous emission of energy. Well, X-rays are man-made, right? So we turn on the machine, and only when we initiate the X-ray tube do we create X-rays. So it's not radioactive. which is not the same as nuclear medicine, which we'll talk about in a second. When the patient has been exposed to nuclear medicine, then they can be radioactive for some time. But what you want to know is that X-rays are not radioactive. Not radioactive. All right. Atomic structure, important things to know is the atomic number, atomic mass, and the nucleus and subatomic particles. So the atom consists of the atom consists of, beautiful, let's use this one. The nucleus, which has protons and neutrons and orbiting electrons. So when we say subatomic particles, for our purposes, we are concerned with these three. The electron, which is negative, this is a review from physics. Electron, which is negative, the proton, which is positive, and the neutron, which is neutral. So when we say the atomic mass, we're speaking of the number of protons and neutrons in the nucleus. Atomic number is just the number of protons. Incidentally, the number of protons relates to the density of the structure. So that's going to be important later on. So structures with higher atomic numbers are denser. They show up different on X-ray. So for example, oxygen, the atomic number of oxygen is 8, whereas calcium is considerably higher. It's going to be 20. Your bones have a lot of calcium in it. So you can imagine it's denser. This is why your bones show up as white on X-ray. We'll talk about that in a second. All right, so atomic number is number of protons, atomic mass, number of protons and neutrons. It's in here. And what's in the nucleus? That's a nucleus. And subatomic particles will be the protons, positively charged, electrons, negatively charged, neutrons, no charge. Ultrasound. Well, ultrasound does not need a controlled environment because there's no radiation. We're using sound waves. It's the most user dependent. What does that mean? Well, if the user does not angle the probe properly or does not use the right technique and the right parameters, we won't get a good image. That's what it means by user dependent. The X-ray is user dependent also because if you don't put the patient in the right position, then you won't get the proper diagnosis, right? But ultrasound, it incorporates a whole lot more. And the technologist is required to interpret the images. I put an asterisk here because the final interpretation is not typically left to the ultrasound technologist. However, in a lot of settings, there is no radiologist in the room when the ultrasound is being performed. And the doctor just gets the images with the initial read from the ultrasound tech, and they agree or disagree or ask for more images, that kind of stuff. So the doctor does not perform it, much like X-rays, but the technologist has to document a whole heap of stuff pertaining to what he or she sees when they performed the ultrasound exam. So the important distinction here, does not need a controlled environment. It uses sound waves. The technologist does some interpretation of the images. It also has the least risk to users and patients. It creates 2D and 3D images. Least risk for the obvious reason, it does not need a controlled environment and there's no ionizing radiation. All right. MRI, we can see what MRI stands for. There's a video here on that also on ED Puzzle. But it uses magnetic energy. Must be performed in a controlled area. Now that's not for the same reason that why we do X-rays in a controlled area. MRI uses a large magnet. So as you've no doubt heard, if you have a metallic object close to the zone 4 or even zone 3, it could be huge problems. And maybe you've heard on the news or not, where people have been severely injured by bringing the objects in the MRI room that shouldn't be there. And they become a projectile and it's a huge problem. It must be performed in the control area for that reason. And you have to be screened for certain objects before you enter the MRI room. Provides 3D imaging. I'll show you that in a second what that looks like. But here's a typical example of an MRI image. Notice we don't get a lot of detail for the bone, right? So MRIs are typically done for soft tissue. It's time consuming for image acquisition. So there's a part of the video also talks about how long an MRI is. Make sure you watch that. And it can create 3D images similar to what we can get for CT. A bone density scan. This has the lowest risk, the lowest amount of ionizing radiation that we use in the diagnostic setting. Very, very low, to the point where the technologist is in the room, just sitting behind a lead shield. There's no console area. They're sitting in it's a tiny room for a bone density room. Let me see if I could find a picture. Bone density room. You can see how small this room is, and this is pretty much how it's done. You can see it over here. The patient lays on this table. That's the bone density scanner, and that's the technologist sitting over here. Sometimes they put a lead shield to separate them. When I used to do it, I'd put a lead shield separating myself and the patient. Regardless of how low the radiation is, there's no need to add to your cumulative dose. All right. Even though it's at 90 degrees, so the chances of being exposed are much lower. All right. What's bone density is more predictive than diagnostic service. So predictive of possible disease. So as the name suggests, the bone density scanner is testing the density of your bone, and it can be used as a predictor to tell if you're likely to have a pathological fracture of your bones or not. In some cases, it can be used to diagnose fracture, but the most common reason for a bone density scan is to evaluate whether or not you're likely to have a pathological fracture, meaning your bone gets so weak due to osteoporosis that it breaks spontaneously. All right? How long it takes? Between 10 and 20 minutes. And you get the 2D images of the lumbar spine and the hip. Typically, they can do other parts of the body, but generally speaking, most routine bone density scans are done of the lumbar spine and the hip. Nuclear medicine. Now, earlier we spoke about whether or not x-rays are radioactive, and I said no, x-rays are not. Nuclear medicine is radioactive, and it uses a radioactive material, so you can inhale it, you can ingest it, it can be inserted, it can be injected, and what's happened is it gets picked up by certain parts of your body depending on which type of pharmaceutical they use. So all you need to know is nuclear medicine is radioactive. It's the only one that's radioactive of the modalities that we just spoke about, right? It needs to be in a controlled area for that reason. So the radioactivity or radioactive substances have what's called a half-life. You might have heard this, which means the time it takes for the radioactive material to deplete by half. So the half-life. And that could be hours, that could be days, that could be weeks, depending on the material that they're using. And that just means you will be radioactive during that period, right? And so it can be combined with CT and MRI, in this case called PET-CT and PET-MRI. That PET-CT means positron emission technology. Let me write that down for you. Give me 1 second. PET-CT, positron emission technology. Not positron emission technology. And that can be combined with CT or MRI to give us CT images, but with the radiopharmaceutical being highlighted on the CT or MRI images. And I'll show you a picture of that in a second. Show you a picture in a second here. Let's use PET-CT. So nuclear medicine on its own will look like these over here. But then when we combine that with a CT scanner, we can see not just CT quality images, but also the nuclear medicine pickup, as they would call it. The highlighted areas would be the way the radiopharmaceutical has concentrated. And we can get that for MRI also. So if we look at PET MRI, that's what that looks like. That's the MRI image, PET MRI right there. These are the blood vessels in the brain. That's a circle of Willis. All right. All right, so the last two slides, we'll try to identify which of these, what the modalities of these are. So you can take a guess. So, excuse me. Take a guess on your own. This one will be top left, X-ray. Let me get rid of this. Top left is X-ray. The middle one is MRI. Bottom right would be nuclear medicine. And the top right and bottom left would be CT images, all of the head. All right, and now we're on to the meat of the question, meat of the subject here, CT scans. Now, CT stands for computerized tomography, which the old name used to be computerized axial tomography. Let me write that in here. Computerized axial tomography. Let me see if I can make this even larger. Computerized axial tomography. But we've dropped the axial because now we can get images in all kinds of planes. As a reminder, the axial plane separates the body into superior and inferior halves, or superior and inferior sections, right? So it used to be computerized axial tomography, and now we've dropped the axial to computerized tomography. As a reminder what those planes are, the body planes. The axial plane would divide the body into superior and inferior parts, or axial transverse plane, same name. The sagittal plane will divide the body into left and right sections, the coronal plane to anterior and posterior. All right? Okay. And so the CAT scan or CT scans, they use an X-ray tube. An X-ray tube is in here. And the part of the video would show that also. So make sure you watch that video. Cannot stress that enough. Let me get rid of the speaker's notes. And so it uses an X-ray tube with a bunch of detectors in here, much like your image receptor for X-ray, but a different design. And it creates 3D images just like MRI, but you can see more bony detail than you can with MRI, because MRI is primarily for soft tissue structures, right? So for example, you can't see the intervertebral discs on CT very well, but on MRI you can. And so then if it has an X-ray tube, it stands to reason it uses ionizing radiation, as you should all know by now. It also would require a controlled space for usage, because there's a considerable amount of radiation that's used for CT, much more than X-ray, but much less than in years prior. The X-ray tube and table are in constant motion, generally speaking. So the tube is spinning in here, and the table is moving to give us a spiral type of image. I'll find a video of the X-ray tube spinning in a CAT scan. Give me 1 second, let me find it down here first. And it's actually pretty daunting, so it makes sense why they would why it's all enclosed and there's no transparent CT scanner, right? Because it's a lot of moving parts. A lot of moving parts. Let me see if I can mute this first. I'm gonna just highlight it there so you can see it. I should play. You can see the. Let me move it off and go back a little bit. You can see over here, that's the detector, and the X-ray tube's over here, and everything's spinning. That's the X-ray tube. And look how fast this is gonna spin. Look how fast that's spinning. That's not even as fast as it can go. Let me see if I can speed this up farther. See how fast that thing is going. So imagine if you were able to see that. That would be a scary thing to see. Scary thing to see. All right, so the X-ray tube and the table are in constant motion. So that's some differences between the imaging modalities. A quick reminder, a quick review. What's a disease? Anything that impairs normal function. Patient shows up, we want to figure out what disease is this. We're trying to diagnose a patient. And then after we've diagnosed them, we can then come to a prognosis. What's the likely outcome? We also want to find out what caused this. We will say what's the etiology. They won't use that term very much, but that's what we're trying to describe. What is the cause of this? It's important. And we try to figure out what causes by identifying the signs and the symptom. Objectively, what can we observe? Subjectively, what can the patient describe? I'm having pain. My head hurts. I feel nauseous. Things that you cannot directly measure, not in the clinical setting as we are used to. And then sometimes you can see inflammation, which would be quite common on CT. And what do we use to diagnose all this? Well, a bunch of imaging modalities, a bunch of tools that we can use. And the one that we'll be talking about for the rest of this course is CT scans, right? And some of the differences with CT scans and the others, well, differences and similarities. CT creates 3D images like MRI. It needs control space because it uses ionizing radiation like X-ray, but it's not as long as an MRI, right? So it's quicker than an MRI. Make sure you watch that video because it also talks about the time it takes for a typical CT scan. All right, and that's the end of this recording. So be sure to watch the ED puzzle videos and review this PowerPoint and do the discussion posts. All right, and I'll see you next week.